Hey guys, Dr. Hayley VanBeek here to talk to you all about pelvic floor physical therapy. So you may or may not have heard of pelvic floor PT before, but a lot of people think that it sounds kind of scary, especially because they're not really sure what to expect. So I'm here to tell you, number one, that it's not so scary, and number two, that what you can expect. So what can you expect from pelvic floor PT? So the very first thing that we're gonna do is talk a lot. We're gonna talk a lot about things that people don't like to talk about so much, or don't tend to talk about so much, which is peeing, pooping, and sexual function. Additionally, I really wanna know what your goals are. What do you wanna get back to? How can we help get you there? What we also are gonna do next would kind of step away and kind of do a little bit more of a full body exam. I wanna see, what's your range of motion look like? What does your strength look like? What does your stability look like? Then I'm gonna wanna zoom a little bit more into pelvic floor to see, what is that doing for you? What isn't it doing it for you? So what essentially that looks like is kind of like going to the gynecologist. However, we don't have any fancy, tools or speculums. I'm essentially just using my finger to assess the muscles in your pelvic floor. I actually have this here that I like to kind of show. So here's tailbone, sacrum, pubic bone, and then your hips on either side. And so what I'm doing essentially is just feeling these muscles to really see, are they too tight? Are they too weak? Are they uncoordinated? Can you do a Kegel? Is there pain there? Can we affect change, maybe with some breathing? These types of things. After that, specifically, we'd really want to talk about, what does your plan of care need to look like to get you there? And that really, that full exam, including the internal exam, really helps me see, what specifically do we need to tailor towards your needs here? Who would benefit from pelvic floor PT? Specific populations would be new moms, athletes, really anybody who has had an abdominal surgery, or anyone who's suffering from pelvic pain, bladder leakage, bladder urgency, bowel leakage and urgency, and then any type of sexual function or pain. So those would be the major groups that I would typically work with. So if you feel like that might be you and you want to give pelvic floor PT a try, just go ahead and reach out to us, and I would love to help you through this. Thank you for listening.